You're listening to the Doctor Is In podcast. This is the show where you get the best tips, tricks, and nutritional hacks to help you and your family get healthier. You'll also hear what works and what doesn't work so you don't have to waste your time and money. All right, let's get started.
Hello, my name is Dr. Tony Martin Jr.
And I'm Dr. Martin Sr.
And this is the Doctor Is In podcast, and this is episode 106. And today we want to talk about an article that both of us had read in the past week. And in the article, the question was asked, how do people die from type 2 diabetes? Because it's one of the leading causes of death. And
it's gone right up there. Like it's right up at the top now.
Go back and look at the data for the last 20 years, and it's just like there are two things that are climbing up the list. I mean, you got the normal stuff that's always been there, right?
Cancer, cardiovascular.
They've been at the top of the list for a long time, but there are a few that are creeping up that list. One that always surprises me is Alzheimer's.
Yeah.
Alzheimer's has jumped into the top, as some of the top killers of Canadians and Americans. And the other one, which has just jumped in there as well, and it's only going to climb higher and higher, is type 2 diabetes.
Yes.
There was some statistics that just came out, I think, 2 days ago on the how much obesity levels have risen.
Yeah.
You would think with all the knowledge and education that's out there that it would have put a dent in those numbers, which goes to tell you it's not people's fault. I know that the food industry has done a tremendous job of giving you this idea of part of a healthy, balanced lifestyle, just eat a little less, move a little bit more. And as a result of that, if somebody is overweight, they're viewed as lazy or they're viewed as it's their fault, when the reality is weight gain, specifically the obesity that's going on, is really the result of crappy food that's addictive, that messes up hormones faster than ever before. I mean, the foods that people eat today just skyrocket insulin. It messes their blood sugar levels up. Everything they eat is laced with all this crappy vegetable oils, and it's really creating this epidemic, really, of obesity, which is just going to lead to more and more diabetes.
Yeah.
So the question that was asked in this article was, how do people actually die from type 2 diabetes? Because as we mentioned, it's one of the top killers, but how do they end up dying? And the article, really didn't shed any light on anything. It's more the response in the article that we want to talk about. But at the end of the day, the article was saying it's not that they're dying necessarily from type 2 diabetes, it's just that they die from the complications of type 2 diabetes, right? They're at a much, much higher risk for cardiovascular disease. They're at a high risk for type 2 diabetics are very likely to get some kind of heart symptom, let alone some circulatory issues where they lose their legs, they get infections, and lung and kidneys fail and all those kind of things. So they die more from complications than they do from actual.
Yeah, well, you always say it too. It's our pet expression that you like. You say that diabetes never ends well, right? And the reason, again, I explain this to my patients every day, because a lot of patients, first of all, are very surprised when they come to see me. Because, again, I think, a week or so ago, we were talking about the thyroid. And that's often misdiagnosed because, again, the traditional testing is not looking at everything. And today, it's the same thing in diabetes, because oftentimes medicine will only tell you you're diabetic when you hit certain numbers of blood sugar, right? But, we know from our experience that a lot of people are already diabetic and they just don't know it. It's because their numbers are not over that threshold.
No, they still got high numbers, but not high enough to be diabetic.
Not high enough to be called diabetic, but by all
metabolically, they're diabetic.
Metabolically, they are diabetic. So when you think of it, that sugar, is so highly regulated, and when you think that God has given you an organ in your body called your pancreas, your insulin, right? It's a hormone that's secreted from your pancreas. Its job is to take sugar out of your bloodstream. So do you think sugar is damaging to your blood vessels? Yes.
Yeah, it's toxic, right?
It's so toxic, right? Like that you don't need.
Your body tightly, like as you mentioned, tightly regulates the blood sugar levels, because if your blood sugar levels go too high, hyperglycemia is very dangerous. And if it goes too low, it's dangerous. So you always want to have your body works very, very hard at keeping your blood sugar levels within a certain range. Yeah. You know, there are different hormones whose job is to raise your blood sugar up if it's too low, and there's other jobs of other hormones like insulin to lower your blood sugar if it gets a little bit too high. And we've said this off air, and I don't know if we've talked about this before on a podcast, but our belief is that obesity, overweight, is the body's way of protecting itself from diabetes. Yeah. Because if a person did not have the ability to store glucose in fat cells and make more fat cells, then you would be diabetic right away, right? Your body will store the glucose. The insulin will get rid of that glucose in the blood, will eventually store it in fat cells to protect your body from becoming diabetic. So obesity is a, in my opinion and your opinion, in a lot of ways, is a protective mechanism that the body has to protect itself from becoming diabetic. Yeah.
So again, so that tight regulation, right? That converting the sugar that's produced in your body when you're, the amount of sugar, the 160, 180 pounds of sugar, the flour, the grains, they're turning to sugar rapidly. Now you're storing, getting rid of sugar out of the bloodstream. Yeah, you're really creating a havoc of issues, and your body's smart. Your body knows what to do with that sugar.
Yeah, it's going to do what it can to protect itself, right? So when somebody becomes a diabetic, it's because in a lot of ways the body has just ran out of ways to pack this glucose away from stuff to get rid of stuff, right? So it is really interesting when you think about it that way. Now, the thing that got us going about this article was really a quote or a comment from a chief medical officer, who's in charge of diabetes care, and he was referring to the fact that diabetics seem to be at a much higher risk for heart disease. And he said basically, and we don't know why that is.
Hello?
Yeah, he doesn't know why that is. And can it be that maybe because the thing that causes obesity, the thing that causes diabetes is also the same thing that causes heart disease? Yeah. That maybe diabetes and heart disease are just symptoms of the real issue, a real underlying issue that causes them both. And we call, obviously, that's that high circulating insulin.
Yeah, that's high circulating insulin syndrome. Right?
Some people that have high circulating insulin will be diabetic. Other people will have heart disease. Other people will get dementia, Alzheimer's. Every organ in your body has the ability to become, quote unquote, diabetic. Your brain can become diabetic. Your liver can become diabetic. Your kidneys. Yeah, kidney failure.
Vital organs, right?
So at the end of the day, they're looking at this thing, in my opinion, they're looking at it all wrong. They're like, why are diabetics more likely to die from heart disease? Well, how about they're the same? Their cause is the same. They're just different symptoms of the same problem, which is high circulating insulin. Yeah. And this is what frustrates us. Yeah. And there's something else in the article.
Imagine a medical officer of health asking the question, why would that be?
Well, they're looking at it like it's two separate in a vacuum. Like you move from one disease to the next, and that's the problem. They're like, they have one disease, which is diabetes, and then they develop another disease, which is heart disease, when reality is they're just symptoms of the same problem. Mm-hmm. They're not two diseases, they're two symptoms. And I know we want to classify diabetes as a disease because it is classified as a disease. But in our opinion, the underlying cause of diabetes is high insulin, which brings us to the second thing that irritated us about this article is when it came to, at the end of the article, the suggestion was, and I'm going to read it to you because it just kind of I'll read you. It's important to have good disease management from an early diagnosis. I wish those that are listening could see us right now because we're almost standing up as we're talking now. We're getting worked up about this. It's kind of funny, but it's very unfortunate because we, first of all, hate that word management. Yeah. When the word management is used, what they're basically saying is you're going to have it for life, so you better get used to it, and we're going to try to make this as comfortable as possible.
Can you imagine in the boardrooms of the big pharma, they're sitting around and remember, like they're giving each other, first of all, high fives because they've duped everybody. And then second of all, they're saying, now remember, what is the word that we want to get doctors to think about? Management. We want you to manage diabetes. Can you imagine, like, whoever said it first must think, that guy, they got his picture up on the wall.
Well, yeah, because
they say, man, that guy was a genius. He told us, it's the light went on, and look, we're going to forever manage diabetes, and we're going to bring in billions and billions and billions of dollars a year.
Right? I mean, research, last summer, a lot of research came out about the current approach to, managing diabetes, and it doesn't end well. No. Amputations are up. Eye diseases are going up.
Cancer's
kidney failure,
up,
cancer,
up,
yeah.
Alzheimer's
It's
is
not
up.
working. And what's so frustrating is that, how many studies have shown complete reversal of diabetes when a person follows a, low-carb ketogenic diet. Mm-hmm. Complete reversal. And it's not like we're talking years. It's like 12 weeks.
Yeah.
12 weeks.
Even faster if they want.
That's right, if they do it the right way. I mean, can you imagine?
They do it 12 weeks. They don't even have to be ketosis.
Here you have a disease that mainstream medicine wants you to manage it for the rest of your life. Metformin, insulin, cholesterol medication, because the standard of care, if you get diagnosed with diabetes, you get on a statin drug because you got to worry about cholesterol. You have that. Door number one. So look at this. You come into my office, I tell you you've got diabetes. There's two doors that you can go through. Door number one is lifelong drugs, injections. Eventually, you're going to need more and more injections.
Check your sugar 4 times a day.
After every time you eat, get on cholesterol medication, which is going to make you feel terrible. It's going to give you muscle pain. It's going to affect your memory. It's not going to feel
knock the B12 out of your body.
Or for 12 weeks, low-carb diet. And guess what? Guess what mainstream medicine is telling everybody which door to go through? Because they're not even telling you the second door.
They might even send you to the dietitian who will tell you that, you know what, have a, just eat the Canada's food guide.
Well, we put this in a newsletter. It was from a patient who brought in their eating plan from a dietitian. When I saw that, I mean, it was an eating plan for diabetics. In my opinion, they were missing a word in there. It was how to eat to get diabetes. I mean, it was terrible. This person eating they said they couldn't get their sugars under control. No kidding.
Yeah.
Everything they were eating was going to shoot their sugar levels straight up, and they were going to have to run for insulin after they ate. It's so frustrating. Yeah. But the problem is, again, you have, these medical experts who treat diabetes who are telling people that there are different symptoms and you better learn how to manage the problem early, because if you start managing early, you're going to do better, even though that's not the case, because we know how the story ends. We see it all the time. It doesn't end well for somebody who decides to manage their diabetes for life. It doesn't work well. Diabetes needs intervention. It needs the underlying problem needs to be fixed. And which brings us to another problem, is that, mainstream medicine will tell you that diabetes is a disease of high blood sugar. It's not. High blood sugar levels is a symptom of diabetes. Yeah. So if all you do as a diabetic is manage your sugar levels, you're going to have diabetes for life, because all you're doing is fixing a symptom. You're not fixing the problem. You're just fixing a symptom. Diabetes is a disease of high insulin. You have to fix the insulin in order to fix diabetes.
Yeah, absolutely.
So that's the frustrating aspect. When we read this article and we were talking about it, it really irritated us.
Yeah.
It's 2017 and we're still reading stuff as if it's the 1980s and all these whole grains. And man, I remember I was filling in for you on the radio, your old radio program that you used to do. And somebody called in and they were saying that they couldn't get their blood sugar levels stable after breakfast in the morning. So I asked them, what are you eating? Well, I'm having toast.
Cereal?
Yeah, Cheerios.
Yeah.
And yogurt.
Because it's got a heart on the box, right? It must be good for me.
Man, if you add up, first of all, the amount of carbohydrates that person was having for breakfast, when diabetics essentially have to look at themselves as being allergic to carbohydrates, first of all, they were getting almost no protein for breakfast. under 15 grams, and all the protein came from grains.
Yeah.
So they got no protein, ridiculously high carbs, and they weren't eating any fat. No kidding, their blood sugar levels. So if that person there, all they had to do was get rid of all the grains, have tasty bacon, eggs, throw some protein for breakfast, and,
watch the difference.
Watch the difference.
Yeah. But
that's not the advice that's out there. It's so frustrating, which, again, and this is something else that just came out. We just, might as well just talk about this because we found this interesting as well. And it's kind of on the same topic. The Lancet recently wrote an article, and Lancet's one of the oldest journals out there. They wrote an article, and what they found was that 55% of all cancers diagnosed in women is associated with being overweight and obesity. I mean, that's more than 1 in 2. So over 50% of the people, well, specifically women that were diagnosed with cancer, were either overweight or obese, which again tells us, so what's going on there? What's the problem? What's the underlying issue? And again, we can't stress this enough. Obesity, being overweight, is the body's way of protecting itself from being diabetic. It's the body's way of protecting itself from high circulating insulin, which again tells you that a lot of these cancers, and specifically they talked about cancers like breast cancer, liver cancer, kidney cancer. A lot of these cancers that are common in women are associated with obesity and overweight. Now, of course, if a person is overweight, it does not mean they're going to get cancer, because it's not the overweight that's the problem. It's actually what's causing the obesity, what's causing the overweight, what's causing all these hormonal imbalances, which is high circulating insulin. That's causing the problem. And what I have found interesting in this Lancet article that was written, what I found really interesting was there was a big difference between men and women. So 55% of cancers diagnosed in women was associated with being overweight and obese, but only 24% of cancers diagnosed in men were associated with being overweight and obesity. So what we see is a big difference between men and women.
They react completely differently, right? To the same underlying problem, right? When you got high circulating insulin, it hits a man differently than it does a woman. Not that men can't get cancer, they can. But generally, metabolically, they're different. Women are affected.
Yeah, men will get the heart.
Yeah, men will get the cardio, they'll get the heart. And you see it. You see it. Like if you go, my wife always, your mom always teases me about, I'm looking at the obituaries all the time, right? Well, when you get my age, it's not unusual to look at obituaries.
No, that's unusual. No.
But you know what? I'm always fascinated by young people when they die, right?
Yeah, it is. If you scan
young men that are dying or women that getting, like I get this time of the year because people coming to my door, they want to raise money for cancer, and they're out running and they're wearing pink, and everybody's got pink on and all that. And I think, you know what? I just want to lecture. I want to say, hold on, like it's not working. This is you're missing the whole reason. Women, cancer, breast cancer, crazy. It's food. There's other factors, we know that. But it's such a big thing, right? And getting insulin down. Men, heart disease. When a man isn't feeling good, when a man is tired, their insulin's going up. It's almost invariable. I see it every day in my office. When a man comes in and he's not 10 out of 10, it's not their thyroid. It's not like a woman. It's not, it obviously isn't estrogen or whatever. And it's usually not even their adrenals. Their insulin is too high. They have high circulating insulin, and they're starting to get fatigued from it.
And that goes, that's right. That high circulating insulin will cause inflammation. And, back on episode 100, we talked about the deadly triad that's found in all disease. And obviously insulin, high circulating insulin is like a precursor to inflammation for so many conditions. So, as we're running out of time and as we wrap this episode up, the takeaway is this: diabetes, obesity, heart disease, a lot of cancers are symptoms of the same cause. They're just, it's high circulating insulin that's showing up differently in different people. And there was a study that was done that found that only, obesity only predicts insulin resistance in 18% of the people. So it's not there are a lot of people that are not obese or that are not overweight that are also insulin resistant. They have other symptoms. Insulin resistance can show up so many different ways.
Yeah.
It has obesity. We always just tie it in with obesity. That's just one possible way that high circulating insulin can show itself. It can show itself in so many different ways, and that's what we're talking about today. So, still, in our opinion, one of the best things that a person can do for their health is lower insulin. If you are a diabetic listening to this episode, you are absolutely allergic to carbohydrates. You have high circulating insulin. Go do the research. It's out there. If you want to reverse your diabetes, a low-carb, ketogenic diet has shown to reverse diabetes in 12 weeks, which is much better than door number 2. Management, lifelong management of your condition. So again, we want to thank you for listening to this episode. If you have any questions, you can email us at info@martinclinic.com. If you want to hear Dr. Martin Sr. here every Thursday morning, you want to watch him on Facebook. He does a Facebook Live. A lot of people watch that, a lot of questions. You answer their questions. You're on there for as long as it takes to answer those questions. So go to our Facebook page, follow us on Facebook so you get notified about that. If you're not a newsletter subscriber, go to our website and sign up. We talk about a lot of these things. We put a lot of information a couple times a week. And finally, if you're listening to us on iTunes, if you could do us a favor and just go ahead and just leave us a quick rating, a quick comment, we would really appreciate it. Again, thank you for listening and have a great day.